Thanks. Okay, good morning, everyone. I'm Jennifer. I'm the Teaching Liaison Librarian here at University of Newcastle, and I'd like to introduce you to my colleague, Jane, from the University of New England.
Good morning, everyone. Of course, I'm at UNE and look after medicine, health and psychology.
So we would like to do an acknowledgement of country. So I would like to acknowledge the traditional custodians of the lands within the University of Newcastle's footprint areas, the Awabakal, the Darkinjung, Biripi, Worimi, Wannerua and Eora nations. I pay respect to the wisdom of elders past, present and emerging, and extend this acknowledgement and pay my respects to any Aboriginal and Torres Strait Islander peoples here today.
I'd like to acknowledge the Anawan, Darug, Biripi, Worimi and Kamilaroi people, the traditional owners of the land on which UNE has campuses, and I welcome everybody today.
So we're just going to pass over to Ben now to do some housekeeping.
Hi, everyone. I'm just going to pop through a poll that I would like you guys to fill out for me. Just a bit of background. We'll do one at the start and one at the end. And throughout the webinar, if you have any questions, please feel free to pop them in the chat and we'll answer them as we go, or we can hold them off until the very end. That poll is going pretty well. We'll just wait a minute or two just to get up to 100%, hopefully.
Yeah, I'm happy to take questions through the course of the webinar. What about you, Jane?
Yes, absolutely.
Excellent.
Perfect. So we've got 100% on that poll. So back to you guys. Thank you.
Okay. Just close that off my screen. Okay, so you might be wondering why we're doing a webinar between the two institutions. So both Jane and I provide library support into the joint medical program. So when I thought of doing this webinar, I contacted Jane to see if she was interested in collaborating, and she said yes. So thanks very much.
Thanks for the idea, Jennifer. It's great.
Okay, so what we'll do now is we'll proceed with the webinar. So are you still seeing my PowerPoint screen that says evidence-based practice? Excellent. Okay, so during the course of your studies, you would probably come across the phrase evidence-based practice. If you haven't already, I'm sure you will. So for those of you who haven't, I'm just going to give you a very brief definition, if you like, of what evidence-based practice is. So it's basically combining your patient's wants and preferences together with your expertise and experience as a clinician with the best available evidence. Okay, so that leads to the question then, what is evidence? So evidence is information that's derived from any research-based activity. So what I'm going to do now is pass over to Jane, who's going to talk about the different types of evidence.
Thanks, Jennifer. It's always nifty when things fit into a couple of categories. And there are two types of evidence that you might be looking for: the primary and the secondary. The primary is original research, and you could think of it as unfiltered, as you're reading what was written by the people who ran the study and not somebody's interpretation of it. As a student, your lecturer may ask you to find primary or original research, and I've certainly had some students come to me lately and ask for help to find original research. There might be other types of research out there, we're going to look at that later, but you're being encouraged sometimes to find the primary because they want you to get comfortable with reading original research and doing your own appraisal. Secondary evidence is classified as filtered, as it provides an analysis or interpretation of various individual studies or primary evidence. Usually they only take the highest quality studies when they're doing secondary creating their own secondary evidence. And Jennifer's going to tell us later a lot. She's going to answer a lot of your questions about secondary evidence. Secondary evidence is great if you're a practitioner. If you're working out in the field, it's going to save you time because someone has already filtered through and got rid of the studies which aren't the most robust. They've found the good ones for you. And you may have learned about this in your course, and if not, you will come across it before too long. So we're not going to go into great detail today, but don't forget you can ask questions at any time. To find the primary evidence. So don't forget it's original research, and we've got a few listed here like randomized controlled trials. I think everybody knows what they are. They've heard of them. They know people are randomly put into groups. And while some people are given a treatment or intervention, another group might be given something like a placebo. But what about the other types of evidence there? Cohort, case control, cross-sectional, or case series. These are observational studies where all of the participants may or may not have the same disease or condition, and they may or may not be given the same treatment. But unlike in a randomized control trial, it's not the investigator or author of the paper who gives the intervention. So that's why they're observational, and observers writing the paper. To find these studies, I can recommend off the top of my head 3 very good databases, and they're on the screen. CINAHL Complete is my choice for nursing and allied health. So it's my choice for nursing, podiatry, dietetics, psychology, all the allied health disciplines. There's way too many to list. And I usually recommend my researchers look at either Medline or PubMed, but not both. And you might notice a lot of similarity between these 2 databases. PubMed contains the same resources as Medline. So the Medline resources are within PubMed, but PubMed also has some extras like PubMed Central, free articles that the public can just easily access. Medline is the choice for many researchers because everything in Medline's been indexed with mesh headings, and there are some very powerful search tools in Medline. So I usually recommend PubMed as an easier option and Medline as a more powerful option. Maybe in the chat, you'd like to tell me which of the 2 you use, or do you use both?
Can I add something to what you've said as well?
Please.
So when you're at university, you've got access to a host of databases. So things like Medline, we have different Medlines available on different platforms, I guess. So we subscribe to here at Newcastle, we subscribe to the Ovid version of Medline. I think, Jane, you said you subscribe to the Web of Science version of Medline. I know other institutions might subscribe to the EBSCO platform of Medline. But so at university, get used to using the 2, because when you become a clinician, you may go into the public healthcare system. You may go and choose to work in private practice. Now, if you're in the public health system, you will also have access to a different array of databases. But in the private practice, it's highly unlikely a private practice is going to be able to afford to subscribe to databases costing hundreds of thousands of dollars. So PubMed will probably be your go-to because that is free and it's provided by the National Library of Medicine in the United States. Okay, so do you want me to look at the question now and then we'll let you get ready to search, Jane?
Yes, and we'll note that Ben has put the database links, the links to our pages.
Or is this not moving? Okay, here we go. So when we were preparing for this webinar, we initially were going to include how you develop a clinical question using the PICO method, but we discovered very quickly that that is an entire webinar in itself. So what we've done is we've prepared a question here, and we've provided links to guides that we have that take you through this process. So have a look at both of them if you wish. They're both open. You can have a look at them, and then that if you have any questions, just get in contact with us. Otherwise, let's now look at a question that we want to look for evidence for. So in patients with chronic diabetic foot ulcers, is maggot debridement therapy effective at promoting wound healing? Was there something you wanted to add to that?
I have a question, Jennifer. So Now Complete has an option for including or excluding Medline. How does this fit in to PubMed/Medline?
Hang on, say that again.
So Now Complete has an option of including or excluding Medline. How does this fit into PubMed/Medline? Okay,
so if you're searching Senal, for example, you're going to be probably searching resources indexed in a variety of different sources. If you probably don't wish to include the Medline versions, because undoubtedly when you search database, you're going to have, what's the word? Duplication of results across different databases. It's inevitable. So if you want to see what's only in the Senal and not focus on the Medline version, then sure, exclude Medline. You probably will notice a difference in your results. When you're searching, like with University of Newcastle, Ovid, you are only searching Medline content. Okay, and when you search, what was the other one? PubMed. When you search PubMed, you're searching, as Jane said, PubMed content plus the extra databases, which are subset, and that is Medline and PubMed Central. So therefore, that accounts for the variations or the discrepancies in the results that you get when you search across the different databases. I hope that answers your question. Oops, sorry. Jane, you might want to take over and share your screen to do your search.
Okay, just stop your share if you would, Jennifer.
Oh, sorry.
Here we are in Senal Complete. And the question we just had from the floor was about the excluding Medline records. That tick box is there. So I'll just leave that off because I don't mind, in this search, I don't mind if I pick up Medline records. It could cause a bit of duplication, maybe a bit of extra work. Thinking about the clinical question that Jennifer had on the screen, I'm going to search diabetes and maggots. I could make a very fancy search string about the diabetic foot ulcers, the debridement. I think I'm going to save myself some time today and just keep it pretty simple. In any EBSCO database, I like to try the TX text field unless I'm doing the abstract or the title. TX usually gives me a pretty good result. Running that search, and I've found 338 items. You usually get a pretty good number of matches in CINAHL Complete. It's been running for more than 50 years. It's a well-established health database. There are two ways that I can bring up the primary evidence, the original studies out of the 338. One is to go back to the advanced search. And scroll down the page and look for publication type. Most health databases will let you filter by publication type. I'm going to select randomized controlled trial. And I could have a second choice if I held down my control or command key. So you can have multiple choices there. But you might have noticed there's also a tick box. So they know that people very often want randomized control trials. So they've actually made you a tick box. I'm going to run that search. So out of 338, only 3 randomized control trials. I actually would have expected a few more, but you never know what you're going to get.
Yeah, the other reason that it could count for that too is they may not have tagged it as a randomized control trial. Yeah, so that's another reason why. So again, another disclaimer. This is useful if you're searching just for a few references for your assignment. But if you're doing a proper systematic review or something like that, then obviously you would need to do a more structured, detailed search.
And you'd also need to visit more than one database, correct?
Absolutely, absolutely.
Now, Jennifer said they may not have tagged it, like they have tagged this one here, randomized control trial. So sometimes you might actually take off that limiter and put what you want in your search, like and cohort, if you're looking for that sort of study, or observation or observational. So sometimes you actually build it into your search. I said there's another way to find different types of studies here, and I'd never noticed it till recently. There's a show more there, and in there you'll also find those publication types. Any questions about CINAHL before we leave it?
Actually, I'd be interested in that exclude Medline just to see what results we get.
Let's do it.
I think that was a question from, just very quickly looking, it was Francis. Yeah, let's have a look.
I know, Francis. So 338 became 262. So 100 or so were, almost 100 were from Medline. And you can do that in different databases. So, oh, well, you'll see Medline content in different databases. Like one of my favorite databases, Embase. They make it very obvious what's coming from Medline. So if there are no questions about CINAHL Complete, I'll show you the next database which can give you primary evidence. Medline. Maybe you use it on Web of Science like I do sometimes, or Ovid. And I'm going to just do a different search, but I get the same results as if I type diabetes and maggots. I like to, some days I like to do it one word at a time. And I'm going to see what this map term to subject headings does. It gets you to think about, oh yeah, there are different kinds of diabetes. There's type 1, type 2. But as our research question didn't specify, I won't choose one of those. I'll actually break one of my laws of databases and use the back button. Sometimes you just have to. So I'll take I'll take off the mapping and just do a normal keyword search for diabetes. Then a normal keyword search for maggots. And put them all together, diabetes and maggots. And then I just want to see the primary evidence, the original studies. So I click additional limits and publication type. And again, I could hold down my control or command and get a few different kinds. I'm going to have observational study, the humankind, and randomized, hold down my control, randomized control trials, the humankind. So I got 2, and limit a search. And where do they get those lists from? You'll see words like clinical trial level 1, wording like that, you'll see comes from the National Library of Medicine in America. There's a website that shows them to you. What did we get? 1 and 2 and 1.
Oh, because we went 1 and 1 and 2. Oh yes, we went 1. Yep, sorry.
Just look up what I was expecting. I was expecting 1. So you may not get overwhelmed with research, and that may be indicating that maybe you could run your own study one day. So maybe it's showing that there's a gap in the knowledge. Sometimes databases don't actually have the full text. You might have to go track it down in another database, or the librarians can help you. Any questions about Medline? And if not, you can put them in, and if you're a slow typist, just keep going. And we look at PubMed. I could do it word by word. Most databases, you can do it word by word or just all together. Personal preference. And I did leave my filters on last time, so I'm going to take them off. So if you remember, this Medline and PubMed are have similar but not the same content. So you may get similar numbers. You should get similar. 23 here in Medline, 200 in PubMed. So it's dragging in a lot from somewhere like PubMed Central, I think. I have all of these different types of trials, the same names that we saw over in Medline. And if you haven't clicked additional filters, it'll look like that. So they show you the main ones, and then there's additional filters that can bring up the rest. And now I've got this really long list. I want my randomized control trials, and they're probably on the top, aren't they? And my observational studies. Just again, be careful. If you pick the veterinary one, just be aware that you're picking it. So this has already told me there are no observational studies that meet this search criteria, but I should do a bit better with the randomized controlled trials. 4. So one of those in Ovid and Medline, and 4 here in PubMed. And I don't think I'll show you much more in those 3 databases, because we still have to look at secondary sources, secondary evidence. Are we ready for that? Have I forgotten anything, Jennifer?
No, I'm ready to go with the secondary if there are no more questions.
We just have a question.
Oh, okay.
If I were looking for a focus on statistical data, where would I go?
Does that sound like a quantitative secondary type question, Jennifer?
Yeah. Yeah, I'll be talking about meta-analysis. So, yep.
Okay, over to you.
Screen 2. Okay, so are you now seeing again my question? Okay. So secondary evidence. So as Jane said, secondary evidence is pre-appraised evidence. So they analyze and synthesize. Oh, I said it. That's great. I wouldn't have problem saying that word, synthesize. Synthesize lots of primary studies, and they appraise them and they choose the best ones. Okay, so a systematic review does that. The difference between a systematic review and a meta-analysis is basically a meta-analysis looks at the statistical side of things. So they do a statistical analysis and synthesis. Okay, then you've got things like evidence summaries. So they basically summarize best available evidence on a specific topic or specific question. And then you've got guidelines as well. So they provide therapeutic information for clinicians maybe, but usually, sorry, but there's no reason why you can't look at them if you're doing an assessment. So sources. We've got things like BMJ best practice, we've got Cochrane Library, and then we've got ETG complete. Okay, so I'm just going to go quickly into these and show you. Okay, so BMJ best practice is a good one to use because undoubtedly you're going to need to find information in a condition, and BMJ is my go-to. I like the interface, very simply laid out. Just waiting for the second screen. Good. Yep. Okay. So if we're looking up diabetic foot ulcers, ooh, I'm on tab. Okay. If I click on diabetic foot complications, it gives me an overview of the condition, the etiology, diagnosis, management, follow-up, and link to resources. Okay. So here we've got some guidelines. As I said, guidelines provide quick summaries. So the guidelines are listed here. So they list them. They've got international guidelines. Australia is often either classed as Oceania, if we're lucky. Otherwise, we're termed under rest of the world sometimes. Okay, so if you don't see Oceania, you might want to look for rest of the world. So here we've got something that leads to a guideline that was developed by the NHMRC, the National Health and Medical Research Council of Australia, and the Baker IDI Heart and Diabetes Institute. So you can access that there. The other thing that they have are evidence summaries. Okay. So remember I said evidence summaries, they focus on a particular question and they summarize the evidence for that. We've noticed that these ones leads to a page error for some reason, and I checked with Jane and that does the same thing with the UNE version of BMJ best practice. However, don't worry, we know that they're available in the Cochrane Library through the Cochrane Answers database. So we're going to go into Cochrane and show you how to access those. So the Cochrane Library is made up of a number of databases. Two of those that we're going to talk about are the Cochrane Library, Cochrane database of systematic reviews. They're known as Cochrane reviews. So Cochrane does actually prepare and supervise the systematic reviews, I guess, and they're considered usually the gold standard in terms of systematic reviews. And remember, I showed you BMJ. There were some clinical answers there. That's the other one that we could choose. So if we're doing the maggot therapy and diabetic foot ulcers, so again, just very, very quick, simple search. So out of that, you can see we've got 0 Cochrane reviews. Now, that doesn't mean that a systematic review does not exist. It just means that there is no review that was conducted by the Cochrane group. Okay. I'll show you later how we go back and look for ones. Now, remember we had our clinical questions here to do with evidence summaries here. So what we're going to do is copy that, for example, come back to Cochrane. Let's go to put that in there to find our clinical answer. Can we find our clinical answer there? Yes, it is. That's the one. Okay, so that's the evidence summary that we found in BMJ that we can now find in Cochrane clinical answers. Okay, so then you just go through that and have a look at, and they developed the excuse me, they developed the question by the PICO method, so therefore you can see all the different PICO elements, and they've compared alginate dressings here to different other forms of dressing. Okay, so you might find this useful as well. So coming back to our Cochrane reviews, remember I said that there was no review for the maggots and maggot therapy and foot ulcers. So again, remember we said before, always search more than one database. Okay, so if we're doing PubMed, for example, in the interest of time, I'm just going to go straight to PubMed. You might want to look at Medline as well. I'm just going to go to PubMed. Okay, do we have systematic reviews? Let's click on that. Yes, we do. Okay, so maggot debridement therapy is systematic review. So this systematic review basically probably wasn't supervised by the Cochrane review group. Doesn't mean it's of lesser quality. It just means for some reason Cochrane didn't do a systematic review on the topic of maggot debridement therapy, but someone else does. So again, just look at the, you need to appraise the paper for, to determine the quality of the evidence and that sort of thing. Even with a systematic review, it's probably a good idea to do that as well. The last one that I wanted to show you was ETG complete. So often you're looking for guidelines, Australian guidelines, and ETG's a good one to use because that is an Australian product. Where's ETG complete? Have I gone past it? No, down the bottom. Here we go. Oh, it's giving me a forbidden error. Jane, are you able to access ETG complete through yours?
Yes, let's give that a go.
Okay.
So University of New England databases, ETG.
You share your screen too. Yeah, I'm not sure why it's coming up with this forbidden error, but anyway, I'll have a look into that. Okay, just, yep, scroll down. There was just down the bottom.
I know my pharmacy students use this a lot.
Yeah, so they provide access to Australian therapeutic guidelines. So if you're looking at topic of diabetes, for example, just click on that and we'll see what comes up. You can browse the guidelines. Okay, so there's information there on, guidelines with regards to treatment of type 1 diabetes, etc. You can also do a keyword search. If you go up to the search button, let's do maggot therapy. Okay, so it's taken us to a result called biological wound debridement that's contained within the ulcer and wound management guidelines. So if we click on that, it'll give us like an evidence summary, I guess, in a way. Yes, and biological debridement, larvae are applied to wound bed. Therapy was compared with hydrogel dressings. large randomized control trial, and then you get the reference to the trial there. So you can follow that reference and have a look at that. Okay, so coming back to Kerry's question on statistical data. Kerry, there's a number of ways, like if you wanted to look at a meta-analysis, you can. Otherwise, there's probably other areas you'd probably look at depending on what the topic was. Are you able to give more context to that question? COVID-19? I'd probably start with the databases like Medline, and then maybe things, maybe the NHMRC. Jane, can you think of any others off the top of your head?
World Health Organization, ISIS database.
Yeah, so things like that. So, but yeah, start with the databases. They may not, because COVID-19 is such a new thing, but you might get some that are indexed in things like Medline, PubMed. Yeah, the World Health Organization databases. There's also a database, I think it's NRN or something like, I can't remember. There's any research librarians on here that I can put something in the chat? I can't remember off the top of my head, but otherwise just get in contact with one of us and we'll look into it further. Okay, so that brings us to the end of our webinar. Do we have any questions from anybody?
Not at the moment, but I will launch the second poll.
Okay, and what I've got up here, I hope you can see, we've got Booker librarians at both UNE and UON, so we've got the links there as well if you need to book a time with us. Okay, so it looks like more people are a lot more confident now. That's great. Good to hear.
Awesome. Thank you for filling out that poll, guys. Thank you.
So if there are no more questions, I guess we'll finish up here, and thank you everyone for coming, and thank you, Jane, for collaborating with me on this.
Thank you very much, Jennifer. It's been a pleasure.
Yeah. Okay, thanks
Thanks, everyone. Bye-bye.